DZRJ 810 AM or on YouTube, channel DZRJ 810 AM, Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗛𝗵𝗶𝗶 as we discuss the latest health and medical topics with doctors from 𝗛𝗵𝗶𝗶. For a healthier and uplifting lifestyle, tune into Healthline with 𝗛𝗛𝗶𝗶𝗶 on DZRJ 810 AM, Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗛𝗛𝗵𝗶𝗶, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗛𝗛𝗵𝗶𝗶 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi everybody and welcome to Healthline with 𝗛𝗛𝗵𝗶𝗶. I'm your host Nicole Jacinto. We're here with Dr. 𝗂𝗏, and she is a dermatologist specialist or dermatology specialist, of course from 𝗛𝗛𝗵𝗶𝗶, the prestigious 𝗛𝗛𝗵𝗵𝗏 Hospital. And doctor, we were just saying before the show, we were chatting a little bit. You are not only a dermatologist, but you have a subspecialty in pediatric dermatology.
Yes.
Okay. So folks, today's topic is acne in teenagers. So it's very apt that doctor will talk about this, and I'm not certain that we've actually tackled this in our past shows. And I know a lot of people would be interested now if it's your kids or your cousins or you. I know a kid who watches the show. He's been watching it throughout his years. Now he's a teenager now. So, just in case it happens to you, you'll get some facts, some information, and Dr. 𝗂𝗏 will be educating us. So, okay. So, doctor, it's very, the fact that you have a subspecialty in pediatric dermatology, that didn't exist before. I mean, we never came across doctors who subspecialized in that when, I guess when we were younger. And I think it's really important because there are differences, right? For an adult and a child.
Of course.
Yeah.
The skin is totally different.
Mm-hmm.
Now, it's a very young specialty. In fact, in the US, they just celebrated, the society in the US just celebrated 50 years, where I'm also a member, the Society of Pediatric Dermatology USA. And here in the Philippines, we just founded the PDSP, Pediatric Dermatology Society of the Philippines. And this was founded in 2022. So it's a very young society. We're composed of 18 pediatric dermatologists distributed over the Philippines. So we have Metro Manila, we have in Northern Luzon and Mindanao.
Okay. That's great, doctor. So you're a pioneer in this, in a sense, right?
Yeah.
I mean, you are one of the ones who, because 2022, this was established in the Philippines. And as you said, it's also a young society in the US. And you're a member of that as well. So you trained there or you practiced there for a while?
Actually, I did my training at Hospital for Sick Children, and that's in Canada.
Okay.
And most of us really, because we don't yet have that specialty here to train residents. So we have to do fellowship abroad.
Okay. So folks, just basically outlining that the doctors also who are in 𝗛𝗛𝗵𝗶𝗏 or who practice there are doctors like Dr. 𝗂𝗏 in dermatology, and the doctors that are guesting on the show have also trained abroad. And for us in the Philippines, that's a good thing because we're not as advanced as the first world countries, and it's good to bring back knowledge. So thank you for doing that, doctor. Okay, so let's get to the topic, which is acne in teenagers. What exactly causes acne in teenagers, doctor?
Well, acne in teenagers, we all know that, diba, they say this is when it starts because of
Yeah.
the hormonal changes which happen during puberty. And there's a surge in that androgen, there's that increased sebum production that happens. And of course, also you have to consider what are the other causes of acne in general. It's the bacteria, it's the oil rich that clogs actually that environment. And of course, genetics also plays a role.
Okay, so genetics does play a role. So,
Yeah.
doctor, as you're saying, no, there's puberty, so the hormones start kicking in, different hormones. So that's really the time. And
Yeah.
what exactly is what you mentioned, the surge in androgen? What exactly does the surge in androgen do, and how? Why is it related to more acne in teenagers?
Because when you have that surge in androgen, it causes inflammation. And that inflammation is the one that triggers again the sebum production. So when you have increased sebum production, I usually tell my patients, I explain it to them in a way that they can understand. You know, when you have, let's say in a toilet bowl, you put
Okay.
a lot, there's a lot in the toilet bowl,
Mm-hmm.
and then there's too much. What happens? It overflows, right? So there's a clog there, and then it overflows. So that's exactly also what happens with acne.
Okay.
In a simplified, layman's
Yeah.
term, when you have that increased sebum production that the body cannot excrete it on its own, then that's when you start to get formation of attraction of that bacteria, increased sebum, and therefore you start having, first, of course, it becomes like whiteheads, blackheads,
Yes.
like comedones.
We have to
And
go
then,
through all of
yeah,
that.
that's when it becomes already, you have bigger papules,
Mm-hmm.
you have the yellowish lesions, which we call pustules.
Mm-hmm.
And then when it's very severe, okay, then you have the big bumps, the nodulocystic acne. So
Okay.
there are different phases really of acne.
Okay.
Yeah.
And
And the way, yeah.
so, no, sorry, I didn't mean to interrupt you.
The way we categorize it is, of course, we don't give you the lesions. We just say, oh, you have mild or moderate or severe acne. So
Mild.
even in the medications, when we want to treat the patients, there's a certain algorithm.
Okay. Doctor, you mentioned you used the word sebum, and that means oil.
Yes.
Okay, so it's oil. And so that's why you said the oily face. And that's true. No, it does happen when you're a teenager. You're like, why is my face always oily? And then maybe later you can, when you tell us how you treat it and how, teenagers can deal with it. I remember during my time, people are just like so upset. And they would use like over the counter things and then cleaning their face, even in school, with cotton buds. And then, oh my God, why is it so black? And there's where the bacteria that you were talking about comes in. Why, like you're going to school or something, and then you're just exposed for a while, and you're like, why is it so black? And then some of us would even use alcohol. And then as a derma, you're like, oh my God, why are you putting that on your face? But anything, no? Anything to see like why is it so oily, and taking it out. Okay, so doctor, when it comes to that, so it's really, as you said, it's a phase because of puberty and the changes that happen in the body. But are there also, and it can be genetic also.
Yes.
And then you want to talk about whiteheads, blackheads, and now, or is it like if it's a whitehead? Since you mentioned it already, what does that mean? I mean, just so that people know. Usually we can tell, but we may not be sure. Like, is that a whitehead, a blackhead? What happened? How do you get that?
Okay. In layman's term, okay, they're actually comedones.
Okay.
And then it's white when it's very, when it's close, it's almost like just like a bump, like
Small bump, then you see that white
yeah.
thing. Okay.
A blackhead, of course, the pores are open. And that's when, of course, when it's open, that's where dirt comes in. And that's where most of them will try to pick on it, try to
Yeah.
clean it.
Take it
And
out.
that's one way of causing damage also to the skin. That's where they get scars, actually, because they go beyond the epidermis. And so when they go deeper and they irritate it, that's when you can cause scarring.
So they go beyond like the first layer of skin, or the one that can, and then, yeah, I've seen people like just dig into their face, or, you know, like, and then someone's helping pa, like, I'll press it for you. You know, a well-meaning friend's like, I'll press it for you. I can't stand it. Let's pop your pimple now. We hear that all the time. Let's pop it now. And then, of course, the other one is the blackheads. And then the other one is when it's already like a big pimple, and sometimes it hurts, no? I mean, it's like, oh, it's a pimple. I need to leave it alone or clean it. And sometimes it pops up at the most inconvenient time, and especially when you're in puberty, you kind of get conscious because you've never had that before. And, it's a time of just general self consciousness. So, doctor, how about, you mentioned genetics, and of course, it comes with the surge in hormones and androgen, which makes your face oily. I mean, jump the steps and it makes your face oily, and then bacteria can so the bacteria gets attracted to the oily face. Okay, doctor, are there any lifestyle habits that also contribute to teenagers getting acne, like what they eat, the hygiene, like how many times do they wash their face, what do they wash their face with? Before, when I was a teenager, some people would say, oh, now that you're a teenager, or even other teenagers informing or misinforming other teenagers would say, well, now that we're teenagers, we have to change what we use to wash our face. So are there any kind of lifestyle habits or like hygiene and things that teenagers might eat, or the activities they engage in? I mean, even including sleeping habits that contribute to getting acne?
Okay. In terms of habits, indeed, there are many things that can aggravate. The number one thing that they're doing is they're trying to pick on it.
Okay.
A lot,
So,
right? And so it gets irritated.
do not touch.
Yeah, it destroys the barrier. No, they're so impatient with how the acne or that bump is. In terms of, let's say, the washing that they're doing, you can overwash, or some will tend to overwash, and then again you break that barrier, right? So when there's too much washing, and therefore the basic thing that we have to remember is they should use a cleanser that will soothe their skin.
Okay.
Okay, so we have what we call synthetic detergents. These are cleansers that are very gentle. They don't break the barrier, and that the pH is like an ideal pH of almost 5. So it's not too acidic and it's not too basic.
Okay.
Okay. And then you were talking about food, right? Food, or what are their practices? Before, we used to say, like, a lot of people would say, oh, you eat a lot of chocolates, you eat a lot of oily
Are you
food.
busting now, doctor?
Huh?
Bust some myths now.
Oh, myths. Not yet, but what
Sige.
I'm trying to say is that now they have discovered it's what we call the glycemic index.
Okay, so it's really
The higher the index, the more sugar and the higher the glycemic index is, then it produces more, it attracts more, produces more sebum, and therefore produces more inflammation. So it's not the food basically per se. And nowadays, they can Google, what is the glycemic index of what I'm eating now, which one? I mean, there's a whole long list that they can Google. I'm not very particular on, but I know, for example, like fruits. Watermelon has a very high glycemic index. There are certain fruits that are very high, and there are certain fruits that are good.
So that's very interesting, doctor, because like before they say, hey, you're eating chocolates, you're eating this, you're eating that. But actually, you could be eating something that you think is healthy or is healthy. Watermelon can be healthy, but because you're a teenager and you're experiencing puberty and there's a surge in hormones, that put together, if the food or if if it's food, junk food, whatever you call it, if it has a high glycemic index, so that means higher in sugar, the more sugar you take in, and if your sugar levels are higher, your blood sugar levels, correct, are higher, then it doesn't necessarily mean that they're very high na parang, oh, diabetic ka na, hindi ganon. Pero the more sugary stuff you eat, the more it will produce sebum. Okay, that's great, doctor. And also yung mga washing habits, no, it's good that you said people can overdo it. Kasi baka mamaya recess so umaga wash ng face, recess din. My friends used to do that. Recess, lunch, after dismissal, when they get home, and that will also break the barrier. So you can't, I guess, because some people might have this idea that the cleaner my face is, or the cleaner I am, even if you take 3 showers a day, it may not make a difference in having pimples on your face. Doctor, do you also deal with pimples in the back or, other areas?
Yes, of course. But mind you about the washing of the face. Some of these kids now, they tend not to wash their face at night. They just sleep, and then I think it's very important that before they sleep, and especially those who get a lot of acne, especially on the forehead or the sides of the face, I always recommend them to at least also shampoo their hair, because when they come to school outside, all the oil and grime is there, and then it goes to their pillow, of course, everything. So the daily habit, of course, we always follow what is a good habit. A good cleanser, a good moisturizer, and then, of course, in the morning, like a sunscreen.
Doctor, you mentioned over the counter, or I guess it's best that if you're really, we'll talk about when you should already see a doctor, but the tips you're giving, there are synthetic, I guess, face cleansers, as you said, that can take out the dirt and be gentle on your face. So you said washing, and then I guess it's a cleanser. Please correct me if I'm jumping. And then a moisturizer of some kind. I how can you guide them, for people, for the tips on what the best things to use are? Because there's so many products out there now, doctor. Even even for adults, they have all these. Well, maybe we can get into that later, unless you want to comment on it. It's like peel your skin, diba? There's all these things out there, and you don't. I mean, some products are good, even if they're not well known. But there's all sorts of things that people use now to, I don't know, beautify themselves. And teenagers especially might get into it, like, oh, peel my skin and do this and do that. And you might think, okay, I'll wash my face with some cleanser, something really, really strong, to make sure the dirt is gone. And then you might be slapping on a lotion on your face that's for your body. Like, what's the difference, diba? Parang, or your back, if you have pimples on your back, maybe you should treat that area differently.
Of course, because the reason also for back acne is not only, well, of course, there's sebum production, but sometimes this is also, there's fungal growth, what we call 𝗛𝗏𝗁𝗶𝗵 folliculitis. And so the treatment may be totally different, especially for the chest and back.
Yeah.
For one, that some of these kids, they would go, some of them would go to doctors as well, and then we would do acne surgery, like the correct way to clean. We call it acne surgery. We don't actually breaking. So it's an acne surgery. So on the chest and back, you do minimal acne surgery because you can cause scarring and keloid formation.
Okay, yes, that's very important. I mean,
yeah. And there are many ways to treat back acne. Well, it's not easy. And that, I believe that when they start also, definitely when they have back acne, they should go see a doctor and a dermatologist.
Okay, doctor. Okay, so you've mentioned some of the safe and effective ways to treat acne. And then let's talk about when someone should see the doctor and what do you do. You already mentioned one thing which you call, what did you call it? Something surgery? Sorry, it slipped my mind just now.
Acne surgery.
Surgery. And it's not real surgery na you have to get anesthesia, di ba? We don't want to freak out people. And parents, ano, magpapa-surgery ka para lang sa pimples. So we get that reaction, like, they get gulat. And it's something, I know it's something that's, you know.
It's pricking, di ba? It's pricking,
Yeah.
pricking. But there's also a technique on how to, that's what we teach our residents in Makati Medical Center. The correct way to prick, to do acne surgery, so you don't cause any scarring.
Yeah. You know, doctor, before, or even until now, sometimes when you go to, let's say, a beauty parlor or a salon, they'll say, I saw an expression there because I want to hear your opinion. Oh, why don't we do your face? You need a facial. We'll take out your pimples and this blackhead and whatever, and then they dig into your face. How do you, give me your opinion about that? Because you just mentioned not scarring and the proper technique. Mm-hmm.
Okay. I have nothing against facial. Okay.
Mm-hmm.
So it's like, what is a facial? If you want to go relax, it's like having a spa. That's what you're doing actually for the face when they do the facial. They cleanse, they steam the face, no? But they have to be trained, maybe clinicians or aestheticians, so they don't cause any scarring. Okay, that's very important. Because the technique on how they will prick it, okay, they can cause more damage sometimes.
Oh, marami akong kilala sa parlor at salon, so wag kayong magtampo because sa akin, because you know that we just have to ask. Like as doctor said, there's also training naman for clinicians or as
Aestheticians.
yeah. Okay, so pero syempre if you're just randomly going to some place that you don't know, and doctor with the facials, he said like steaming is okay because it opens up your pores, and I guess when you put some kind of mask on, you know, that's very, I guess that's very, now, even over the counter, di ba? How do you feel about masks? Oh, myth busting. Yun na nga, binibili na lang, ang dami na eh. I'm like, sometimes I talk to people, what's that? Oh, this is from Korea, this is from Japan, this is from China, this is from whatever. And then they wear the mask at night. And I don't know, they drink collagen, they say they will take out their pimples. And maybe that's a whole other topic, but maybe can you comment on that? Para at least we get the full picture and we're informed.
I have nothing against masks. It's like you're putting a moisturizer on your face. I mean, but you have to know what's in the mask, right?
So they keep saying, if we can't read it,
Yeah.
it's another language. What if it's like, go ahead, doctor.
Usually they will put hyaluronic acids or maybe retinols, which are mild vitamin A's that can soothe, or vitamin C's. They will claim that there's vitamin C, but
Yeah.
I don't know if it's really vitamin C because these vitamin C's are very specific and they have to be negatively charged for them to really penetrate the skin. So for me, it's like putting like a moisturizer on your skin.
So it's like moisturizing your face, and then it doesn't like cleanse it. So if you didn't wash your face before that, it can a moisturizer add more oil to your face if you do not wash it first.
Can-
Like, could it be like adding more oil? Parang pinapatungan mo lang ng, making it more oily. Kasi
But-
some say, I won't wash my face now because I'm using a mask at night. Ganon.
Well, for me, it's not a substitute. I would still recommend cleansing the face, no? And sometimes if you have a good cleanser, that's already good enough. You don't even need facials.
Okay, all right. Thank you, doctor. Wag ka na lang mag-facial if you really have a problem or think you have a problem, which we'll talk, we'll ask you when should someone go to a dermatologist. Maybe go to a dermatologist na lang. And yung totoong derma kasi, sometimes I see yung, derma siya. I'm like, derma ba talaga yan? You know, parang, it's very easy to claim that you're a derma and you have a clinic, but I've seen some places where there's no dermatologist present to supervise, and they have all sorts of treatments. And I just like, I accompany people. I'm like, I don't know, man. I don't know if this is legit, if you're really going to get the results you want. But doctor, let's talk about, oh, sorry, go ahead.
Nicole, can I train the audience?
Sure.
No, not train. Actually, inform the audience that
Yeah.
what is a dermatologist? A
Yeah.
dermatologist is a physician who underwent 3 years of training in a recognized institution by the Philippine Dermatological Society. So we're many societies already. I think, if I'm not mistaken, we're 18
Mhm.
institutions, all distributed in the Philippines. Okay, and they do 3 years of residency training in dermatology, and then they have like a board examination.
Mhm.
And then from there, you can do a specialty that you like a fellowship training.
Mhm. Yeah, doctor, because when I've talked to doctors, dermatologists who practice in hospitals, and sometimes they have their own clinics, that's okay, right? Or they hook up with other institutions that are not hospital based, but they know certain things like, okay, a patient will come in. This is not teenage acne na, but this is maybe a more serious thing, like the skin is just like parang it's slowing off. I mean, it's just sort of peeling. They know, okay, because it's your medication or it has something to do with something else that you're taking. Parang you go deep. You are doctors who have trained and had to pass a board exam and who go deep into it. I'm not putting down the other people, but if you really want to know what a dermatologist is, as you informed us, it's not like, oh, I can prick your face off, therefore now I'm a dermatologist, and or I took an online course and and practiced on some people, and so now I'm a dermatologist. Yeah, because the term is interchanged so much. That's what I find. Go ahead,
But
Doc.
you see, acne can be treated by a general practitioner or
Hmm.
family medicine. But when they encounter already difficult cases, like the nodulocystic acne or maybe a difficult back acne, then that's when they can refer already to a dermatologist.
Okay, doctor, let's do some myth busting before we, as you said, pwedeng general practitioner can treat it. When we go into when should a teenager or maybe a parent who's concerned about the teenager and the teenager is saying, I really feel bad about this stuff on my face and it hurts, or it's just blown up completely. Can we do some myth busting, like you were talking about food earlier, and you said it's the glycemic index. So you said like, yeah, we've heard that because you're eating chocolates, you're eating this, you're eating that, or you're eating fast food, or you're eating chips. Um, Also, you don't sleep. You
So
know,
sleep is
yeah. Okay, let's talk. So sleep. You need to sleep also.
very,
Um, Yeah, I guess when you're in your teenage years, that's when you start staying up late. I think before it was telebaba, now it's messaging na lang. Did you reach the telebaba?
you always get that conversation on sleep. When mommy
Yeah.
brings the teenager, she'll say, yes, I mean, they don't sleep, they're always on their phones or doing this game, or she hardly sleeps, no. um of course, what happens when there's sleep deprivation, your body is not at its best. you,
Mm-hmm.
you get spikes of that cortisol level, and
Mm-hmm.
therefore again you get that inflammation of the sebum oil production.
Mm-hmm.
And when you get that, then you have an impaired skin barrier and repair again. So your regenerating process is not at its best.
Mm-hmm.
So the question is always, well, it depends, 6 to 8 hours. But I think nowadays I'm
Six,
counting,
8 hours.
it's very difficult because the kids now, they wake up at 4 a.m. to catch up with their bus. I mean, they have to,
Yeah.
when they have carpools.
There's traffic.
Yeah, and
Oh
then
my
they have
God.
to wake up at 4, and then it takes them 2 hours. At least they get a little sleep again.
Mhm.
So
Sleep during class. The teacher gets mad. No. And then,
So in any disease, I think a good diet and having the right amount of sleep is very important.
okay, I was gonna ask you something. How about, okay, never mind. I was just like, something came into my head about, okay, okay, there's also the, so kids, don't feel bad, like if you have pimples, and we're gonna say it happens at that age, and it doesn't mean like you have a dirty face and you keep having to pick on it, and also your sleep. So you think 6 to 8 hours of sleep is good enough, but okay, so 6 to 8. Wow, before they said you have to get 8 hours of sleep. Yeah. But now you're just being realistic.
Yes, yes.
Okay, this is what came into my head. Is it a myth or not? Can stress cause you to break out? Especially as a teenager, because I'm the things they think about are their schoolwork, their schedule, maybe their friends.
Um, you know, it's difficult because there's no study that actually how can you categorize what is stress.
Yes.
Again, it's an indirect way of
Mhm.
saying that, again, when the body is not at its best, again, there's increased sebum production. So yes,
Yes.
stress can aggravate.
Okay. So thank you, doctor, for answering those questions. So when should a teen with acne problems go see a dermatologist? At what point do you say, okay, go na? Because what if, some are saying na, it's mild lang, but it's been here for a year na. Okay, so when do you tell someone, when would you advise a teen or their parents to bring them to see a dermatologist?
Actually, it's when when the child wants.
Yes.
Because it's very difficult actually, and also when the child and the parent need some advice. I
Okay.
think that's when they can see it. There's no actually category
Okay.
because, as I told you, we have mild, moderate, severe.
Yes.
Um, a child who has very mild acne but is very bothered, and
Mm-hmm.
then it can be a very big stressor to her day to day living, no? Or somebody who has very severe acne and doesn't really mind, about it, and she's
Doesn't
okay.
get stressed, parang,
Yeah, it's okay lang. So there's no hard and fast rule.
There's no hard and fast rule. And yes, I mean, sometimes you will have parents going, I'll bring you to the derma. I've seen it. So I'll bring you to the derma and dragging the kid. And the kid's like, oh, I don't need to, diba? Or it doesn't fit my schedule. I'm supposed to study and then go out with my friends on that day on Saturday, diba? Then I'll bring you. And then sometimes you have kids saying, I think I need to go to a derma. And the parents like, what? You're so young. I mean, we still have these like, preconceived notions of when someone should go or if they're even old enough. So, okay, folks out there, if you're thinking, parang it seems to be like, no, that's more of an adult thing. I mean, before, at least, people would think that's more of an adult thing, no? And it's really, like you said, doctor, you hit the nail on the head. It's when the teen is ready and when the parents are also ready. But you are a pediatric dermatologist, so your kid can't be too young to see Dr. Sarosa. Okay.
Correct.
Okay, your kid can't be too young to see Dr. Sarosa. All right. Now, doctor, you mentioned the mild, moderate, and severe. Can you give us just like symptoms or signs of what we will see on faces or backs or something? And I'm glad you mentioned, by the way, the shampoo earlier. Because especially if people have bangs, and then it's there in the hair, it will cause you mentioned the forehead also, it will, like, you gotta wash your hair. Anyway, sorry, back to the mild, moderate, and severe acne.
Okay.
This could be-
Mild is when they have the white heads, black heads,
oh,
right? And usually that will be on the T zone, the
the T-zone of
forehead,
the
the
forehead
nose, and the
and
chin,
the chin.
right? And these are the ones that don't really cause scarring.
Mm-hmm.
When you have moderate, then you have already those bumps that you can feel, and then those yellowish things, which we call pustules. Okay.
Posture. Okay. Because there's pus.
Yes.
Mm-hmm.
So
So yellow.
yellowish, right? And then
Mhm.
sometimes when they touch it, it's very painful.
Yeah.
So maybe Then you would say when they have that already, papules and pustules, that's already a moderate type of acne. And
Okay.
then, of course, the severe is when they have so big bumps already all over their face, and it can be already disfiguring. It's very uncomfortable. No, that's the severe acne.
Okay. I noticed, like, I know some people where they just didn't care. You know, the teenagers themselves just didn't care, and their parents wanted to bring them, but they scratched their face and all of that. So they had scarring until adulthood, you know, some scarring because, but they didn't care. And then the others will go naman with the parent or be the one to initiate. Like, I want to take care of my skin, you know. So at least we know that if it milder, the like whiteheads and blackheads, you know, you should poke my face. Maybe I'll go to you. You should. There's stuff there. I haven't had a cleaning in a long time. And then also there's the moderate, which, as you said, it's the one that has the yellow pus, and it's a bit painful because that's an ano na, no, that's an infection of sorts. I mean, a small bacterial infection.
Yeah.
And the severe is when it's the bumps, you know, and they can hurt too, or and then people want to press it. Want to press your face, you want to press it. You said there's reminding people of the T-zone, doctor. That's the forehead going down to the nose and the chin. Also, doctor, is it correct to remind people and teens not to like wound yourself there, because that infections in that zone, like if you wound yourself in that area, like you dig into your nose so much and it bleeds, and then you don't tell your parents, like it can lead to an infection in the brain. I
Correct.
think you're not. Okay.
Yes. Then you can get cellulitis. You can get so many things. I mean, for young, yes, cellulitis, infection, and then we have this dangerous area of the face. That's what we're saying, the infection that goes to the brain, right?
Yes. Okay. So don't don't, because and then there are all these like videos out there like, I want to pop a pimple. Ugh, I don't. I mean, okay, but you know, I've warned some people, hey, don't do that. You know, you can get an infection seriously. Doctor, what kind of treatments do you give teenagers who go to you for, let's say, mild, moderate, and severe? And how about chemical peels? Are those advanced treatments? Because you see that everywhere. And also, you know, you get so much information. Like some products will say that you can do the chemical peel at home, and they will peel your face. I've seen so many people use that, and for 7 days they're like dying because it's stinging, and their faces are red. But you know, is that very dangerous, or what exactly is the proper chemical peel, or those places where they're just they're just, sorry, I don't mean to say just, I mean they're not hospitals or they're not affiliated with doctors. Okay, they're trained, but you know, people go there a lot for chemical peels and all these things. What can you say about that, doctor?
Okay, first and foremost, regarding the peels, there are so many peels that are available. So you have to know which peels and what's the purpose. Okay, so I think this is very deep for the audience because we have lactic acids, we have mandelic acids, we have different kinds of phenols, gesture peels.
So the ingredients basically,
Yes,
they're all different types, and they treat different types of acne.
yes.
What would you, go
Maybe
ahead.
what will be available over the counter, or maybe that's very safe, is maybe glycolic acids, which is like fruit acid peels, which
Okay.
are quite mild. And peels, it's not like peeling in sheets. You know, people don't actually like that when they see big sheets, or you know, their skin becomes very dry.
Or it falls off. It actually peels. You feel like pulling the white stuff.
That's very rare because people don't like that anymore, and so even companies don't make anymore stuff like that. Rather, they would do like, and that's why it's called micro peeling. The benefits of peeling is maybe for hyperpigmentation, or like, it depends also what peels you're putting, no? So for those with an uneven skin tone, or improving scars. But it's not like a one-time thing, huh? You have to do series of peels. And as you peel the patient, you can go stronger and stronger, or higher and higher. And so that's also where the danger is. If you peel too much the skin, okay, you can cause more injury.
Okay. So that I'm glad you said that, doctor, because it's not just a one-time thing, as you said. And then if you're just doing it at home because you got a product, you wouldn't know what dose to put next.
Correct.
I mean, even if you read it, and then if you are going to a place and they're not very trained, or they're just following, I mean, when you go to a doctor, a derma like yourself, especially for teenagers and kids who might overdo things or might underdo it, it's individualized treatment, doctor.
Yes.
Okay, so that's also the benefit of going to a doctor, and to going to Dr. Sarosa, who's also a pediatric dermatologist, because I guess maybe the skin is different, or you would be able to tell, and you're very versed in understanding children and teenagers who are still considered children, right? Until they're, I mean, kids till they're
Yeah.
yeah. Well, I'm still a kid, even if I'm my mom's and dad's kid. But yeah, it's a different subset.
Correct.
You treat them that way, and you treat them like you would know, you don't need so much, so let's lessen it, instead of making it sobra, and then I don't know, maybe burning
So
your-
you were saying individualized. That's the difference, no? Like when you see, like us, when we treat, we don't have sets, no? Centers kasi would have a set for, oily skin, like that. Set for oily, set for dry. Okay. You have to categorize, like, what is the problem of the child, no? And then see what will suit them. So, especially what the child will be able to do. Because sometimes you don't overtreat, you don't give them so many things that in the end, they don't get to use.
Yeah, that happens a lot,
Yeah.
doctor.
So, and then, in the end, you have to ask them first, do you have the time? Are you willing to apply the medicine? No? And do this every day? Because we can't, make miracles. No? We can't do magic also.
Yeah.
And one thing with acne is that it's not like how you treat an infection, that in 5 to 7 days, taking the antibiotic or the medicine, you're okay, right? Let's say you have a cough or colds. For acne, it's a daily routine. They have to follow something so that their skin also will improve. And that's why there's a routine that they have to really do properly.
And you're so wise in saying, can you really do this? Will you really do this? Because there are so many products that aren't used in the end. Like, I mean, of course, you'll ask you, can you wash your face and do the and then put the, this and that. And if they say, no, I really won't have time to spend an hour on my face, then you will adjust the treatment and the stuff, the stuff, but the product you will recommend.
Before you adjust, you have to talk to the child that this
Yeah.
is what she needs.
And
I'm not adjusting to what she can do. Actually,
Yeah.
I have to, let her know, let the child know. In fact, I always tell them why they're getting acne, so they know the principle, and they
Yeah.
know that this is what's causing it, so that they understand.
And usually when people buy sets over the counter or whatever it is, over the counter or on the internet, or they go to an institution, it's not individualized. It's like, okay, here, you came last time. Okay, you're late, and then, because we miss appointments, and then pack, we'll do it now, and then and then they'll say, do this, do that, put this, but you won't put it naman on your face, so you're wasting time and products in a way. Yeah, you are actually. So at least, doctor, with you also talk to the child, and you get the perspective So the parents don't freak out and go, why is your face still like that? Kasi she didn't wash it there. He didn't wash it naman talaga. You know? And then they'll be like, can you give him something stronger? But no, he really doesn't want to wash it. So, that's the thing. It also requires the participation of the patient.
of the child.
Yeah.
And actually, it's nice Filipino patients, our patients, they actually listen. And that's why they say, see, the doctor's saying it. And that's what's nice also. No, we get to, we explain to the child, and in the end, they understand.
Yeah.
Because if they don't really understand it, then they won't do it. I
Yeah.
think it's important. Yeah.
Okay. Is the treatment usually different for males and females? I just want to ask that. Okay. No.
Basically, it's about the same. It's
So-
about the same. Yes.
Hormones are the same. Everything is the same.
Well, they have more for males, of course. Maybe the treatment may be a little because their hormone, like we have certain hormones that we give for males now, and for females, like let's say for moderate or severe acne,
Mm-hmm.
the hormonal treatment of oral contraceptive pills are very effective for females, which we don't give for males, right?
Yeah. Okay. So when it comes to treatment, there may be not, there may be a few differences, and it also depends on the individual patient, doctor. And so, okay, so we're coming to that point where, okay, it's not the same for every person. It's individualized. And, so we're coming to the point where I'm going to ask you, like, okay, how do parents or the teens themselves react to the treatments now? Because we've heard that before. Like, for example, let's take a female who's a teenager, and she has a case where the treatments entail taking the oral contraceptive or the pill. Sometimes the parents will freak out. What do you mean? You're gonna give her the pill? I don't know if she's sexually active. I mean, reality, and then the kid will go, I don't want to take it because I'll be misinterpreted. Is there a taboo around that until now?
Not really.
Not really. Okay, that's good.
Not really.
Okay, yeah. And then, okay, so people have been educated about it, and if you want your pimples gone and it's part of the treatment, then you take it. Okay, so that's good. That's good to hear. And then, how does it? Have you seen in your patients how having a lot of pimples and not being able to deal with it or control it, perhaps? No, I mean it's something like on your face, and when you're a teenager, it's a new thing. You're getting these pimples. Have you seen it affect their self-confidence and their self-esteem? Because you can't control it,
Definitely. It affects their self-esteem, especially nowadays. Diba, with social media, and then they will post pictures, and then they will compare with their classmates, how they look, right? So I think it's really very important. But as I was telling you, it depends per individual. So, and how they will really handle it. And so I think it's very important, especially when they have, and the scarring. The scarring can be also very bothersome. And so nowadays, with the treatment that's available, and if treated early, we can avoid scarring.
Okay. And that goes back to the surgery, the acne surgery. Can you tell us exactly what it consists of?
So of course, acne surgery, what it consists of, we have this comedone extractor, and the extractor should be just right. So you don't really, you nick it a little, like you open that pustule, and then you try to extract the pus. And not all lesions that you can see should be pricked. Okay. So there's and that's what we teach our residents. Which ones can be touched, and which ones now you have to wait for the lesions. We call that lesions. For the lesions to subside first, and take its toll with the medication.
In Tagalog, yung papahinugin pa. I've heard that. I'm like, ano? Pero, papahinog.
Rather hinog, papakalmahin mo.
Papakalmahin muna.
Yeah.
Anyway.
Yes. Kasi if you touch it, it's going to be very painful. Or like a child who has so many and you try to prick it, it's going to be like a traumatic experience.
Yes. And then they won't want to go back anymore.
Yes. And I pity talaga. Medyo masakit. It's
Oo.
not that it's not without pain, ha?
Yeah.
So you have also to be very gentle.
Mhm. And as doctors, as you were saying, you train doctors and you know which one not to touch. Or this one, you don't have to touch it. It'll make it worse. It'll be too painful. It might subside on its own, or we have to wait, or whatever the medication. The other. Oh,
Yeah.
so,
Okay. Subside, not basically on its own, but subside because you're going to treat it properly with the medications.
Okay. And you also have that, as doctors, you're like, you can judge, like, okay, maybe if you have like 50, we'll just prick 20 first because your pain tolerance, di ba? Come back na lang. Because if you do it all at one time and you force it, trauma. I don't wanna go back na. It hurts. Baka exaggerated naman yung numbers ko, 50 and 20, pero you get the idea. Okay. And then, so you prick it, and then what do you do? So you take out the pus or let it come out, diba? You don't force it. And then, doctor, what's that sucking machine for the face? Like a long time ago, like, I don't know, when they'd prick pimples, they'd put this machine that supposedly sucks out the... So, was I going to a quack? Did I experience that twice? Like a long time ago? I have a very good memory, so like they said, oh, this will suck out your pimples. Wala nang pricking.
I think that's what they have in the facial centers. Pero this kasi, imagine you're sucking like a very big kiss, di ba?
Oo.
What's the purpose? I mean, di ba?
Yeah.
So you have to let that inflammation first subside. But there are certain areas, maybe that glass thing, that you were saying, it's like glass thing, maybe for the nose, but instead of pushing the comedone extractor, if it will come out, yes. But basically, if you have, this is what we will usually give as a basic medication, is what we call keratolytics. So these keratolytics, that's as good as like suctioning, but it's in the form of a topical medication.
Okay.
So you're trying to shed, or removing the outer layer of the skin. But that's not kasi an over the counter. It's a prescriptive. But in other countries, it is.
Okay. So best to go to a derma who is working within the established system of and the new protocols, because maybe those other things that they do in some centers, they're outdated or they're not complete in how they treat patients and not individualized.
I think naman the centers, maybe one way is because we also have members in our society who have centers. So I don't want to categorize na these centers don't know also what they're doing, because we have doctors in the off-site centers naman eh. There are some PTS members.
Maybe you can look them up.
Yes. Yes, we have a website, so you can see if that doctor is under the Philippine Dermatological Society.
Because maybe the center is closer to your house, or it's more convenient for you. And if that doctor is a member of the Philippine Dermatological Society, then they should know what they're doing. Or maybe kasama nila, di ba? So, and I'm sure you're a member also. So, okay. And then, all right. So, just really affecting the self-confidence. It depends on the kid and the parent, if we've talked about that. And I just had to ask that question about the sucking, because I'm like, what will this accomplish? I see there are different things, and then the peeling of the face and how you do it. Doctor, I want to ask if you've ever encountered a case where, because I heard about this a long time ago. I can't remember who it was that told me, but think a classmate of mine, the doctor gave her antibiotics. Because does that still happen because the pimples on the face or whatever are too inflamed and it's an infection?
Yes, actually, antibiotics is in the algorithm of treating acne. So we have topical antibiotics, which is you can give it actually for mild acne. And then for mild to moderate, in the algorithm of treating acne, you can already give oral antibiotics because there's growth of bacteria, which we call 𝗂𝗏𝗏𝗁𝗏 acne. And therefore, but it's not all antibiotics. There are antibiotics only that will hit the species that is found, in the microbiome of on the face or in the chest, in the back for producing acne.
So, as you were saying earlier, it might be your general practitioner, your family doctor. He could treat you for it, and then or she could treat you for it, and then say, you know what, it's a bit, it's getting a bit severe. I'll recommend Dr. Sarosa. Then Dr. Sarosa can do the whole individualized treatment for you, whether it's acne surgery plus whatever it is, or topical antibiotics or antibacterial, whatever it is. I mean, it sounds complicated, but it's not really that complicated if you just go, especially if it's bothering you. And you know what? Yeah, okay. So antibiotics it's part of it. Okay. So yes, of course, I myself have tried that. Like, oh, there's a pimple. Let me get that. I don't want to mention a brand name, something. I'm gonna put it there. And before there were so many myths, like put toothpaste. Have you heard that? I'm sure you were put toothpaste on your pimple or whatever it is. So anyway,
I said the pimple. No, it's not.
no,
It will.
yeah.
They have that principle that it will dry it up. It's not part of the. There's no studies that says it's effective. One more thing I would like to make a comment, which is very common now, is those patches that they put.
Yeah.
Round things that they put, and basically, it's salicylic acid.
Yeah.
Okay.
I'm the only one who reads the stuff that other people use on their face. I'm like, I don't think you should put this on your face. Thank you, doctor. Go ahead.
So
Validated.
for me, it's like a first aid, but if you're going to use it on a regular basis and it's your treatment, I think sometimes you might just cause more irritation and like a form of contact dermatitis.
Yeah. Yeah, that's why. And then they'll just keep putting more and saying, oh, kasi gumaling yung first three. I'm like,
And then they'll have patches all over.
patches. And then I'm like, salicylic acid. I mean, and parang, I'm like, parang naglagay ka lang ng, yung mga, sabi ko, lagyan na lang natin ng, yung patch na pang pain. Kasi, para, pa. I mean, it feels like you're just, putting the patches for pain, like in the old stuff. I remember people, did you reach the age of Bengay? I mean, they would like just basically just put anything on your face to pop the pimple, and the patches. Okay, so don't, I guess if you've done it and it worked, if you use it too much, it can cause more harm than good. If you're getting more pimples, go to the doctor. Yeah, because it's salicylic acid. Okay. So anyway, doctor, thank you so much for being for being so game with my questions and answering them. And also, is there anything else? Is there anything you'd like to say to those who might think of, and teenagers and parents who, either they have self-esteem? Just address the whole issue, like any advice you can give to those who have self-esteem problems for pimples, or who are considering going to the doctor, going to a derma like yourself. I think very important also that you have you have that subspecialty. Is there anything you'd like to say?
Well, what would I like to say? We've talked okay. So for acne, it's a phase, no, that the child or the teenager goes through, and we're here to help let them go through this phase trying to, let's say, go through that to avoid any scarring or disfigurement that eventually can happen. And mild, moderate, severe, we're just here. And there are many ways to treat acne, but we're basing it on, of course, number one, what is the proper way, the algorithm, and it depends also on the stage, of the acne.
So there's a whole way that medically and scientifically you've come up with it, but you also individualize the treatment. So I think it's very important that you individualize it, and also for someone with your subspecialty. I'm not saying that a dermatologist who doesn't have a subspecialty in pediatric dermatology can't treat a teenager, but it's also it's very interesting to me that it is very interesting to me. I'd like to highlight that you have that subspecialty. So for the parents, Dr. Sarosa also knows how to deal with the kids, because sometimes that's where the conflict comes in. Okay, so and then she will be like, I don't think your kid's gonna wash his face and put all he's not the type who will, and he already said na I can't do all of that. So let's just stick to this level of treatment instead of having all these like things pile up, and it's not in the topic, but warts are different from acne, no? So let's not talk about it. Facial, a lot of people are getting it. Okay.
It's a totally different thing.
Totally different topic. You've also treated teenagers with it?
Of course.
Of course. Okay. So totally different topic. So we won't talk about it na. And we are running out of time. But thank you so much, Doctor, for being on the program, for taking the time to share your knowledge with us, to educate. I got a good education in that, and I feel validated about the patches. Like, yeah. And then minsan, it's expired na. So, pwede pa gamitin yan. Patches, and I'm like, where do they come from? Kasi pinalabas na, pero pwede pang gamitin yan. Okay, bahala kayo sa mukha ninyo. If you turn, I always tease them, if you start turning into some, like, I don't know, whatever you absorbed, just remember that. Thank you so much, Dr. Sarosa.
Thank you also, Nicole. It was nice with you today.
Yeah, it was nice chatting with you and discussing these things that are that serves this program serving as a platform to inform and educate people. And teenage acne is something that's hardly ever talked about, but it's something that is so prevalent. So I'm so very happy that we discussed it today. Okay, I might look you up and go to you. I'm not a teenager, but
well, we see adults as well. Yeah.
All right.
Yeah.
Perhaps I can ask Mika for your number after the show. Or I do know are they teenagers? Oh my gosh, sometimes when you're an aunt, you're like, what? You're already 30? I thought you were 15. Ay, nako. But okay, thank you.
You don't see us for acne, but you can see us for rejuvenation.
Oh, yeah, different things. Yeah.
Makati Medical Center has the Skin and Laser Hub Wellness Center. We have
You are there.
we have 12 machines there for rejuvenation, anti-aging, collagen production.
Yeah, there's a lot you can also offer to adults. I'm glad you mentioned all of that. Okay, thank you so much, Dr. Sarosa. So you also do things in the hub sometimes.
Yes.
The hub has moved, no? To where is it now? Building.
It's in the Ayala North Exchange at the 7th floor.
All right, okay. I remember before it used to be basta when you go into lobby number 2, it was there na. So I have been there. See, I went to proper Dharma for proper treatment with Dr. Well, never mind.
Yeah, come visit us at the Ayala North.
Sorry, Dr. 𝗛𝗲𝗵𝗶. Rest in peace, Dr. Val. Okay. So thank you very much. Thank you. I will visit you there. Maybe. Yeah, I should. And you also treat like older people, right?
Yes.
Because you're like, oh, they're old na, then the age pass. And I said, no, it's because I'm old na, but it doesn't have to be, And you will check out moles, diba? Kasi, okay, so mentioning all the things that you can do for people of all ages. You have a specialty, but you can do a lot more. Thank you also, doctor. Thank you so much. Okay. All right. Take care. Do you want to say hi to anyone before we go?
I'm okay.
Okay. All right. So everybody, that was a great show. I had a nice time with you, doctor. I will ask for your number. Thank you so much. And thanks for watching, folks. We'll see you on Health Time with Makati Week, Makati Med next week. Running out of time, so I'm talking fast. Okay. Thanks, guys. Bye, doctor. Bye-bye.
Nicole.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.